Hello, and thank you so much for joining us on this webinar today. My name is Julia Alvarez, and joining me is Erica Germay from the Jefferson County Public Health Department. We are here today to talk to you about some really exciting initiatives going on in the county and to get your input as valued community members about where Jefferson County should be investing its public health dollars. At the end of our webinar, we will be redirecting you back to a link where we will be gathering your input on 3 very quick questions. So thanks again, and here's Erica.
Thanks, Julia. So my name is Erica Germay. I work for Jefferson County Public Health. So we're a local government agency that works to promote health and prevent disease and injury across Jefferson County. Right now, we're working on a 5-year community health improvement plan. So basically, we're trying to figure out what impacts health in Jeffco neighborhoods and what we can do by working together over the next 5 years to make Jefferson County a really healthy place to live, learn, work, and play. So this is a collaborative process because a lot of different disciplines touch health. So we've set up a health council with representatives from planning and zoning, open space, economic development, housing, human services, local hospitals. We have service providers for seniors and low-income folks, and we have a few elected officials even. Basically, we're just trying to get together all the different organizations and agencies across the county that touch public health. Every county in Colorado is required to go through this process every 5 years, and many departments across the nation are doing this type of process because it's a great way to work with partners to focus on key issues and target resources. So our process started by collecting and analyzing data and looking at our capacity as a county to impact health. Right now, we're looking for public input to help us choose what priorities to focus on over the next 5 years. So we've brought you all today onto this webinar to help us choose what risk factors to focus on. So you might be wondering what a risk factor is. Risk factors are things like behaviors or surroundings that make us more likely to get sick. There are 2 types of risk factors. Non-modifiable risk factors are things we can't change, like our age, our genetics, or our race and ethnicity. And these make up about 30% of our health. So the good news is the other 70% of our health is made up of things that we can change, or modifiable risk factors. So these modifiable risk factors include things like access to quality care, personal behaviors, our physical and natural surroundings, and our social surroundings and economic opportunities. So we tend to think of health as being totally dependent on our personal behaviors and these individual choices, but in fact, social and economic factors alone account for 40% of our health. In just a moment, you're going to have the opportunity to rank 5 different risk factors: poor diet, physical inactivity, tobacco use and exposure, alcohol use, and chronic stress. So we know that our health starts in the places where we live, learn, work, and play. But people who have trouble paying the rent or stretching each paycheck, or who don't live in safe neighborhoods, or who don't have a lot of opportunities to get a good education, these people live with higher levels of everyday chronic stress. This chronic stress already puts them at a greater risk of developing a range of diseases, plus the social and economic factors that produce their stress makes it harder for them to make healthy choices. So for example, people who live in lower income neighborhoods tend to be surrounded by liquor stores and corner stores that sell junk food and cigarettes, but they might not have a supermarket in their neighborhood where they can buy fresh fruits and vegetables. We've chosen to look at these 5 risk factors because the data tell us that they are directly linked to the top causes of chronic disease and death here in Jefferson County. Our #1 killer here in Jefferson County and across the nation is cardiovascular diseases, which impact our heart and arteries. So this category includes heart attack, stroke, high blood pressure, and high cholesterol, among many other diseases. 24% of our deaths in Jefferson County are caused by cardiovascular disease, and nationwide we spend $444 billion a year on them. So the good news is, if we avoid our 5 risk factors, we can protect our heart. So by eating well, exercising, avoiding tobacco, drinking responsibly, and reducing our stress, we can prevent a lot of cardiovascular disease. Cancer is our #2 cause of death. It's responsible for about 21% of deaths here in Jeffco. So together, cancer and cardiovascular disease are responsible for almost half of all our deaths. The good news is over 30% of cancer deaths are preventable, again by avoiding our risk factors. So if we eat well, exercise, avoid tobacco, and drink responsibly, we can protect ourselves from a lot of cancers. Unintentional injuries are our third leading cause of death. They're responsible for about 7% of deaths across Jefferson County. This is a really broad category that includes falls, car crashes, poisonings. We tend to think of these deaths as being accidental, but in fact, many of them are preventable through changes to our environment, behaviors, laws and policies, or product safety. Car crash deaths are a great example. Here in Jeffco, over the last decade, our car crash deaths have decreased by 25%. A lot of that is thanks to safer cars and safer roads and tougher seatbelt laws and drunk driving laws. So despite that huge improvement in car crash deaths, we're still seeing a lot of unintentional injuries, partly because we have an aging population here in Jefferson County. And as we age, we tend to lose our strength and our balance and vision and are very susceptible to falls. We're also seeing a lot of prescription drug overdoses, especially from prescription painkillers. We also know that alcohol contributes to a lot of falls, as well as car crashes and accidental overdoses. So our big risk factors here are physical inactivity and alcohol use. Our fourth leading cause of death is chronic lower respiratory disease, which causes about 6% of our deaths here in Jeffco. These are diseases of our lungs and airways, things like emphysema, COPD, chronic bronchitis, and asthma. Smoking is directly tied to most of these diseases, so tobacco use is our biggest risk factor here. We also see that people who are obese or overweight are more likely to have breathing problems, so physical inactivity and poor diet are also risk factors. At number 6, we have mental health. Almost 3% of deaths in Jefferson County are suicide. We've called this category mental health because there's a lot of stigma and misunderstanding around suicide and mental illness. We wanted to raise awareness around the fact that we all have mental health. It's our social, emotional, and psychological well-being. And it's impacted by stress and our ability to cope with stress. So there are different types of stress. We have short-term acute stressors like speaking on a webinar. We also have chronic everyday stressors like living in poverty or living in a violent neighborhood. And finally, there are traumatic stressors like a death in the family, going through a divorce, or being impacted by a forest fire. All of these types of things impact our mental health. Staying physically active is a really great way to boost our mental health and reduce stress. And using alcohol responsibly is also really important to staying in good mental health. Finally, diabetes is our number 8 killer. It's responsible for just over 2% of our deaths in the county. Most cases of diabetes are directly related to obesity, so physical inactivity and poor diet are our key risk factors here. Between 2001 and 2010, our obesity rates in Jefferson County increased by 59%, and our diabetes rate increased by 89%. The good news is, by focusing on risk factors, we can prevent a lot of these illnesses before they impact people's lives. And that's what we're trying to do by working together on this community health improvement plan. We really want to make healthy choices easier for everyone in Jefferson County. So this might look like making sure that everyone has access to healthy, affordable food, or making sure all children have safe places to play and exercise. Or we could look at developing a smoke-free policy for our open spaces so that we're not exposed to secondhand smoke at the playground. Or we could look at limiting the number of liquor stores that can locate in particular neighborhoods. These are the types of solutions that we'll be working on with our partners over the next 5 years. Right now, we need your help choosing which risk factors to focus on. And to talk more about that, I'm going to hand it back over to Julia.
Thanks very much, Erica, and thank you all again for listening to this important information about what's going on with the health of our county. So I want to encourage you all now to take a moment to reconsider those 5 risk factors. They are tobacco use, alcohol use, physical inactivity, poor diet, and chronic stress. Again, thank you so much for participating in this webinar, and we look forward to working with you to help make Jefferson County an even healthier place to live, work, and play. Thank you.